and my topic today is counseling African Americans. So there's been many strides in the United States for the fight against social injustice, racism, health disparities, police brutality, and economic hardships against African Americans. From the slavery 400 some years ago to Jim Crow laws and Brown versus the Board of Education, to our first Black African American two-term President Obama, to countless celebrities and stars and entertainment and music, to today, Biden and Harris. However, the African American community still suffers from an alarming amount of mental health treatable concerns. Unlike other immigrants who came to the United States seeking, often finding more advantageous political climate and working conditions, African Americans entered the United States unwillingly and has since paid the price for their human rights. Okay, cultural values and beliefs and worldviews. When referring to African American groups, it is not exclusive to all Black people. Someone like myself who may identify as Afro-Caribbean, meaning that we came from sub-Sahara Africa, but rather the African American experience, meaning if you look Black, you may be treated Black, okay? Factors that determine how African Americans maneuver within a white macro culture includes historical trauma, meaning 400 years of slavery, including not being able to vote, not being able to go and sit certain places, and other racial traumas, right? Also, for cultural views, beliefs, and worldviews, race, ethnicity, gender, social class, and colorism all play a part in how African American views. Okay. Okay. For an example of historical trauma, you have the story of Emmett Till, where a young Black boy was murdered and two white people were acquitted. Okay, you have the history of police brutality, as we know, present day George Floyd, and in the past, Rodney King. Okay, and then you have spiritual factors and belief systems. African Americans are very spiritual. They believe in strengths. They believe in enabling individuals to confront their challenges and meet them head on in the church with prayer. Okay, and then you have microaggressions within corporate America. Microaggressions refer to things that people may do in everyday passing and might not know that they are being aggressive, brief everyday exchanges that send degrading messages to people of color and other minority groups. Okay. And then another way that African American views the world has to do with colorism. The complexity of African Americans can range from very, very light and fair skin to very, very dark. While it may not seem significant within the African community and the way that others view African Americans, fair skinned African Americans or lighter African Americans tend to have more favor within corporate America, or with just being seen as less threatening. Okay, seeking clinical mental health counseling services. Okay, factors that hinder African Americans from seeking mental health counseling services include stigma. Okay, there are many stigmas attached to African Americans, such as family values or families are not important, which that's not true. stereotypes that African Americans come from a one parent home, which is not true. In recent studies, it's been shown that up to 69% of African Americans do have two parent households. Okay, and that's found in our reading today. Okay, environment that may hinder African Americans from seeking clinical mental health counseling services include poor neighborhoods, neighborhoods riddled with violence, medical disparities, not having no insurance or having insurance with very little benefits, providing misinformation to African Americans, such as nothing's wrong with you, your insurance doesn't cover mental health, political influences, political parties that come into African American neighborhoods and maybe lobbying for um, community services, but in actuality, they really just want votes. And then you have other things that hinder African Americans seeking mental health services, such as beliefs. Many African Americans come from prayer heals all. And then you have the super woman, the super African American woman who feel like anything can be fixed. Then you have their strengths that can endure anything that life throws at them due to the long history of enduring slavery and other racial segments. Okay, and then you have medical personnel setbacks. So, for instance, when an African American does seek out mental health services, they end up being not diagnosed, misdiagnosed, or harshly diagnosed with like schizophrenia or things that would hinder them from continuing life as normal. Okay, effects of racism and discrimination, sexism, power, and privilege within the African American group. Okay, this includes depression and anxiety, which we know the effects of racism can cause PTSD as well. If someone is pulled over and has a really hard time with the police or other traumas that African American groups meet throughout being followed in the store and things like that can leave a lasting anxious impression on this particular group. Okay. Other instances that affect this group includes living with stressful situations can promote hypertension and other infectious illnesses, cardiovascular diseases from stress, and so on. Okay. Effective strategies and techniques. So within the African American community, establishing trust between client and counselor is a very important factor. There has to be a connection there. It's the cornerstone of treating African Americans. First, connecting with the client. Um, you can connect with just knowing what your client is interested in. You can connect with being up to date on any issues that's going on in their community that or around in their environment. Um, Another good technique or approach to counseling African Americans would be gathering information slowly. So that means not asking too many questions up front, letting the client lead, and following that direction, allowing the client to set their pace. Okay, another technique would be to make zero assumptions. Okay, just because you are counseling an African American client, don't assume that they have the same um, views as all African Americans. Because, like I stated earlier, everyone's experience could be different depending on the group or how they identify as well. Okay. Counselors should not also shy away from race or fear of offending African American clients. You should approach it head on. If the client brings it up, you should acknowledge it. and confirm that you understand African Americans clients' historical trauma. A lot of African American um, individuals sometimes feel that talking about race or slavery from 400 years ago, it's taboo, or you should get over it, but it still plays a part in African American lives today. So counselors should not shy away from that. You should embrace it, especially if the client brings it up as well. Okay, effective theories and approaches to treating African American um, clients. So, of course, cognitive behavioral therapy is always beneficial to anyone that is being affected with anxiety disorders. However, I feel like reality therapy is a good, effective approach to counseling African Americans because it tends to hit their issues head on. It also offers internal control, which is important to a group that may have control and their rights taken away on a daily basis. It also offers African Americans the opportunity to utilize their beliefs and spirituality for coping, which is important to this group. Reality therapy also embraces straightforward way in which African Americans especially converse in their community. So African Americans tend to communicate straightforward, no beating around the bush, so to speak, and everything is usually upfront. Another effective approach that I thought would be a good one is narrative therapy. Narrative therapy allows a client to share their own experiences, which again is important to a client who may have their experiences um, devalued. um, it's important for them to be able to tell their story the way that they perceive it. You may have an interaction with a non-African American and they might feel like you shouldn't be offended. Narrative therapy allows an African American client to tell their story from their side. Okay, narrative therapy also allows a sense of control, again, which is an important aspect. It also empowers the African American client to tell their story and to own their story, and it helps them to feel emancipated. Okay. It also helps deconstruct influence of the dominant culture narrative. So again, they get to tell their story from the African American experience side. Okay. When it comes to advocacy plans and strategy, having culturally competent practitioners in the community is an important aspect. Acknowledging that counselor being able to acknowledge the differences and having cultural sensitivity is also a helpful strategy. Being culturally aware and being culturally wake, okay, or having cultural wakefulness. This means that the counselor is aware of racism, they're aware of trauma informed care, and they'll show cultural humility, meaning self-reflection. They'll allow for personal understanding. The future of counseling African Americans. So, what does counseling African Americans look like in the future? So, part of counseling African Americans in the future includes training culturally competent counselors, having counselors check their biases and check their cultural differences, and just allowing the African American client to share their worldviews and their background. Also, having formal alliances within the community, being aware of the environment or the community outside of where you work, whether it be a hospital setting or a private setting, just being aware of the culture and the community in your radius. And also help breaking down the stigma for the African American group. because within African Americans,